My name is Twyla Braze. I'm president of Citizens Council on Healthcare, a free market healthcare policy organization located in St. Paul, Minnesota. In 2007, the United States spent $2.26 trillion on healthcare, or about 16% of the money spent for all goods and services. In 2010, the cost is expected to be $2.5 trillion. This videotape is to tell you about why healthcare is so expensive here in the United States. President Obama, Nancy Pelosi, Harry Reid, and others in the Obama administration and the majority party in Congress claim that their plan to nationalize the American healthcare system will bring down the cost of healthcare. There are at least 8 key reasons why healthcare is so expensive today, and the 2,700-page Senate bill does nothing to change these 8 reasons. In fact, it has long been proven through Medicare that the federal government cannot control the price of healthcare by providing or paying for healthcare services. Medicare is scheduled to go bust in 2017, just 7 years from today. Meanwhile, there are 77 million baby boomers who are about to enter Medicare, which currently has 44 million people in the program today. Medicare has a $38 trillion unfunded liability. There are millions and millions of Americans counting on Medicare to be there when they turn 65. But there is no money in Congress or the federal government to cover the cost of their care. This is a real crisis in the making. President Obama wants to solve this crisis by putting the federal government in control of all public and private healthcare dollars and in control of all treatment decisions. This would be a tragedy, not only for vulnerable people who need care and cure, but also for individual freedom and the preservation of constitutional rights. So let's look at the 8 key reasons why healthcare is so expensive today. Number 1, Medicare. The first reason healthcare is so expensive is because of Medicare itself. Cost projections were far too low when Congress put this program together in 1965. According to a renowned statistician who worked for the federal government at the time, not only were the cost figures for the proposed Medicare program too low, they also didn't account for the expected rise in hospitalization after the program was put together. As soon as Medicare took effect on July 1, 1966, 19.5 million Americans had access to free medical care. The cost of medical services increased immediately. Just 2 months later, the New York Times reported that hospital bills were increasing at a rate 5 times the cost of living. In addition, some New York doctors had raised fees for seniors by as much as 300%. Some quoted in the paper said the reason they did it was because they didn't want to accept the 20% Medicare discount. Imagine what will happen if the Obamacare bill passes and Medicare cuts at least $500 billion out of Medicare as millions more Medicare recipients enroll. Will doctors continue to see Medicare patients? Costs increase faster in Medicare than the growth of the program. In its first 5 years, Medicare spending increased by more than 70%, while the number of people enrolled grew by just 6%, according to Sue Blevins in the book, Medicare's Midlife Crisis. Surgical rates also increased. During the first 10 years, the number of surgeries for people 65 and over increased approximately 2.5 times, from 6,000 to more than 15,000 for every 100,000 people in the population. In 1965, before the program became law, government actuaries projected Medicare to cost only $9 billion by 1990. This was completely inaccurate. In 1990, Medicare cost more than $66 billion, an error of 165%. In 1970, the Congressional Quarterly reported that the people's use of Medicare was 20% higher than originally assumed. This is what happens in government entitlement programs. If it is free, it will be consumed at a higher rate. Higher demand without a similar increase in supply will increase costs. This will happen with the plan to expand Medicaid in the healthcare reform bills. Various administrators and Congress have tried to rein in the Medicare program, all without success. They've tried price controls, increased payroll taxes. The HMO Act of 1973 meant to eventually force all Medicare patients into an HMO. And they've tried fixed prices for care called prospective payment systems and DRGs. but nothing has worked. In 2001, the Medicare trustees reported that Medicare would be insolvent in 2029. In 2009, the Medicare trustees sounded the alarm when they reported that Medicare will be insolvent in 2017. What will they say this year? 2015, 2014? The cost for Medicare's promise to senior citizens in the future is now $38 trillion. This is nearly 3 times the national debt ceiling, which was raised to 12.1 recently, and it's nearly 3 times the estimated gross domestic product for 2009 of $14 trillion. Congress does not have the money to pay the $38 trillion bill. Now, in an effort to avoid the impending political backlash of Medicare insolvency, President Obama has proposed forcing everyone into a national healthcare system, grabbing everyone's healthcare dollars, and rationing healthcare at all ages. Reason number 2. The second reason for the high cost in healthcare is the move from real insurance to prepaid healthcare. In 1973, to deal with the Medicare cost crisis, the senior citizen run on the U.S. Treasury as a result of Medicare, President Nixon and Ted Kennedy worked together to change the delivery and financing of healthcare in America. They passed and signed the HMO Act of 1973 for the purpose of eventually forcing all seniors into these systems. HMOs and health plans centralize dollars and treatment decisions, much like socialized medicine. HMOs are also prepaid healthcare. Instead of health insurance for the rare and unexpected catastrophic event or expensive chronic illness, the HMO, like today's health plan, covers every medical expense. Every medical expense, no matter how minor, is run through the insurer, and money is prepaid in higher premiums to cover those costs. The HMO then, and the health plan now, have become a third-party financing mechanism for medical care, not a health insurance company. This is the most expensive way to pay for medical services. In 1965, Americans paid 43% of all healthcare costs in cash. In 2007, they paid only 11.9% of all healthcare costs in cash. If only 12% of us paid cash for our groceries, and the other 88% used a middleman to purchase those groceries, we would see not only an increase in spending on pricey food items, but we would see an increase in cost to pay for the middleman's cost of doing business on our behalf. Today there are many very expensive middlemen in the purchase of medical services: the federal government, the state government, the health plans, and the employers. To understand why paying cash for most medical services is not only a good idea, but possible, consider one Investor's Business Daily article. In 1996, the publication reported that 1/3 of 1 million workers in large self-insured plans filed no claims at all. 73% filed claims for less than $500, and 89% filed claims for less than $2,000. That leaves only 11% with expenses above $2,000, and many of them may not be catastrophic. How much are you paying every year for a prepaid healthcare policy that covers the few services you actually use in a year and charges you for the many services you never need or want?